I am Dr. Leana, and I need you to stop what you are doing right now and pay very close attention to what I am about to share with you. Because what you are going to hear in the next few minutes could be one of the most important things you have ever learned about your health after the age of 50. Not because it is complicated, not because it requires surgery or specialist visits or expensive treatments, but because the danger I am about to describe is hiding in plain sight. It is sitting on your nightstand. It is in your kitchen cabinet. It is something millions of people swallow every single morning without a second thought. And it is quietly, silently, destroying one of the most vital organs in your body, your kidneys. Now, before you scroll away thinking this does not apply to you, I want you to hear this one fact. Studies show that by the time kidney damage produces noticeable symptoms, up to 70 or even 80% of kidney function may already be gone. Not reduced, not slightly impaired, gone. That is not a gradual inconvenience. That is a life-altering, potentially irreversible decline. And the most terrifying part is that most people never feel a single warning sign until it is far too late to reverse the damage. No pain, no swelling, no signal. Just slow, invisible destruction happening inside your body every single day. And after 50, the risk multiplies in ways most people are never told about. So stay with me, because by the end of this, you will know exactly what to watch for, what to ask your doctor, and what simple steps you can take starting today to protect yourself. Let me take you inside your body for just a moment, because understanding what your kidneys actually do changes everything. Right now, as you are watching this, your kidneys are processing your blood through approximately 1 million microscopic filtering units in each kidney called nephrons. Think of these as incredibly sophisticated cleaning machines operating at a level so precise that modern technology cannot fully replicate it. Every single day, these nephrons filter around 180 liters of fluid. They remove toxins, regulate your fluid balance, control your blood pressure, maintain the mineral levels your heart depends on, and produce hormones that tell your body to make red blood cells. Your kidneys are not passive. They are active, intelligent, constantly adapting systems that your entire body depends on to stay alive. Now here's what changes after 50. Your kidneys begin to lose what doctors call reserve capacity. That means they lose their ability to handle stress the way they once could. The margin for error gets smaller every year. The same medication that felt completely harmless at 35 may behave in an entirely different way inside your body at 60. And because kidney damage is silent, you will not feel that shift happening. You will just continue taking your pills, living your life, and slowly losing function you can never get back. This is why the next 8 things I'm about to share with you matter so deeply. Let us start with the one that surprises people the most, because this is something almost everyone has used this week. Painkillers, specifically the category known as NSAIDs, ibuprofen, diclofenac, naproxen. These are sold over the counter in every pharmacy. They are advertised on television. They feel completely safe because they are everywhere. But here is what is actually happening inside your body when you take them regularly. Your kidneys depend on chemical messengers called prostaglandins to keep their blood vessels open and maintain proper circulation. When circulation is good, your kidneys receive the oxygen and nutrients they need to filter effectively. NSAIDs work by blocking the enzymes that produce those prostaglandins. And when prostaglandin levels drop, the blood vessels in your kidneys constrict. Blood flow decreases. Oxygen delivery slows. Your kidneys enter a kind of low-pressure, low-oxygen state where they cannot perform their job properly. In the short term, your body may compensate. You may feel nothing. But with repeated use, with daily doses for joint pain or chronic headaches or back discomfort, the tissue begins to suffer. Fluid can build up, blood pressure can rise, and microscopic damage accumulates silently over months and years. The danger is never a single dose. The danger is always the pattern. Now let us talk about something that feels even more innocent. Something millions of people take every morning before breakfast without a second thought. Acid reflux medications. Proton pump inhibitors like omeprazole and pantoprazole are among the most prescribed drugs in the world. They reduce stomach acid. They ease the burning. They work exactly as advertised. But what most people are never told is what can happen with long-term use. Research has linked chronic use of these medications to a condition called interstitial nephritis. This is a form of inflammation that develops inside the actual tissue of the kidney. It is not an infection. It is an immune response. Your own immune system begins to attack the delicate structures inside your kidneys, creating swelling and damage in the very filters responsible for keeping your blood clean. Over time, this inflammatory process can progress to chronic kidney disease, and because it feels like nothing on the outside, people continue taking the same pill every day for years, completely unaware of what is happening beneath the surface. Think about someone you know. Someone who has been on acid reflux medication for 5 years, 7 years, a decade. This is exactly the kind of silent, cumulative damage that unfolds without warning. Now we go deeper, because the next category is where things become genuinely frightening. Certain antibiotics, specifically the stronger classes like aminoglycosides and vancomycin. These are powerful drugs. They save lives. They are prescribed for serious infections that other medications cannot handle, but they carry a significant risk that is often underestimated. These antibiotics can be directly toxic to the tubules inside your kidneys. Think of the tubules as a network of tiny pipelines running through the kidney tissue, responsible for reabsorbing the nutrients and fluids your body needs to keep. When these tubules are damaged, waste begins to accumulate in your blood. Toxins that should be filtered out start building up, and kidney function can decline rapidly. Here is the factor most people overlook. Dehydration dramatically increases this risk. When you are not properly hydrated, the concentration of these drugs in your kidneys rises significantly. And a higher concentration means a higher level of toxicity. This is why hydration is not a small side detail when it comes to kidney protection. It is one of the most powerful tools you have. When you take medication, any medication, your kidneys are working harder than ever. They need fluid to do that work safely. Let us keep going, because the next category introduces something called the combination effect, and this is where things become truly dangerous. Diuretics. Water pills. Medications like furosemide and hydrochlorothiazide are commonly prescribed for high blood pressure, heart failure, and fluid retention. They work by encouraging your kidneys to excrete more water and sodium. On their own, with proper monitoring and hydration, they serve an important purpose. But here is the risk that often goes unnoticed. If fluid loss becomes excessive, blood volume drops. And when blood volume drops, the pressure that drives blood into your kidneys drops with it. Your filtration system slows down. Waste begins to accumulate, and the kidneys begin to struggle. Now here is where I need you to pay very close attention. Many people taking diuretics are also taking a second category of medications called ACE inhibitors or ARBs. Drugs like lisinopril and losartan. These are prescribed for high blood pressure and are actually protective for the kidneys in the long run, especially in people with diabetes. But in the short term, they work by reducing the pressure inside the tiny filtering units of the kidney. In isolation, with good hydration and proper monitoring, this effect is generally manageable. But now add a third medication, an NSAID for pain relief. NSAIDs reduce blood flow into the kidney. Diuretics reduce the volume of fluid in your body. ACE inhibitors or ARBs lower the filtration pressure inside the kidney itself. Put all three together and you create what doctors call the triple whammy. 3 medications, each one affecting the kidney through a different mechanism, all working simultaneously to reduce function. And the result can be a sudden, dramatic drop in kidney performance that comes out of nowhere. The terrifying part is that many people are on all 3 of these medications at the same time. They are prescribed by different doctors. They are taken for different conditions. Nobody connects the dots, and the kidneys pay the price. This is not a rare medical scenario. This is happening in homes around the world right now. Let us continue, because the next medication on this list is one of the most commonly used drugs for managing blood sugar, metformin. This drug is generally safe and highly effective for type 2 diabetes. For most people, it is an excellent medication. But here is the critical detail that cannot be ignored. Metformin is cleared from the body through the kidneys. If kidney function declines, even gradually and silently as we have described, metformin can begin to accumulate in the body faster than it is being eliminated. And in certain circumstances, this buildup can trigger a condition called lactic acidosis. That is a dangerous elevation of acid levels in the bloodstream that can become life-threatening. This is not a common outcome, but it is a real one, and it underscores an important truth. After 50, kidney function must be tested and tracked consistently, because a medication that is perfectly calibrated for your kidneys today may become problematic as your kidney function continues to change over the coming years. What is safe today is not guaranteed to be safe indefinitely, and the only way to know is to monitor. Now, here is one that most people never hear about in this context. Lithium. Used for bipolar disorder and certain mood conditions, lithium is a medication that requires careful long-term management. Over time, it can affect how the kidneys handle water at a very fundamental level. It can lead to a condition called nephrogenic diabetes insipidus, which sounds complicated but means something simple and significant. Your kidneys lose the ability to properly concentrate urine. You urinate more frequently. You lose more fluid. You become chronically mildly dehydrated. And chronic dehydration, as we have discussed throughout this conversation, places ongoing stress on kidney tissue. Additionally, long-term lithium use has been associated with structural changes in the kidney itself. Not just functional changes, actual physical changes to the tissue. This is why anyone taking lithium for years must be monitored with consistent kidney function testing, not occasionally, but regularly and systematically. And now we come to the final one. And in many ways, this is the most unexpected. Contrast dyes used in CT scans and certain imaging procedures. These dyes are injected into your bloodstream to make organs and blood vessels visible on imaging. They are extraordinarily useful diagnostic tools. They help doctors find tumors, identify blockages, and guide treatment decisions. But in some individuals, particularly older adults and those with existing kidney vulnerabilities, they can trigger what is known as contrast-induced nephropathy. Here is what happens inside your body. The contrast dye simultaneously increases oxidative stress in kidney tissue and reduces blood flow to the kidney. Your cells are overwhelmed with damaging molecules at the very same moment that oxygen delivery is being restricted. The kidney is being hit from two directions at once. And in some cases, kidney function can drop measurably within 24 to 72 hours of the procedure. Have you ever had a scan with contrast dye? Did anyone speak to you beforehand about your kidney function? Did anyone assess your risk? For many people, the answer is no. And that is exactly the kind of gap in awareness that this conversation is trying to close. So now you have seen all 8. Painkillers, acid reflux medications, certain antibiotics, water pills, blood pressure medications, diabetes medications, mood stabilizers, imaging contrast dyes. And the question is not whether any of these medications are inherently wrong. Most of them serve critical medical purposes. The question is whether you and your doctor are making informed decisions about your kidneys as part of the conversation around these medications. So what can you actually do right now? Start with hydration. Your kidneys require adequate fluid to maintain pressure, dilute toxins, and flush out both waste products and medication compounds. Even mild chronic dehydration silently increases the concentration of drugs in your kidney tissue and reduces your filtration capacity. Make this a daily priority, not an afterthought. Next, be cautious about combinations, especially the triple whammy. If you are on a diuretic, a blood pressure medication that affects kidney filtration, and you are reaching for an NSAID for pain relief, that is a conversation you need to have with your doctor before you take that pill. Third, test your kidney function regularly. 2 simple blood tests, creatinine and eGFR, can detect changes in kidney health long before symptoms develop. These are inexpensive, widely available, and incredibly informative. If you are over 50 and you have not had these tested recently, make an appointment. Fourth, use every medication with intention. Ask your doctor whether you still need the medication you have been on for years. Ask whether the dose can be reduced. Ask whether there are alternatives that carry less kidney risk. These are not difficult questions. They are the right questions. And finally, support your kidneys through how you live. Anti-inflammatory foods, stable blood sugar, consistent quality sleep, and regular movement all reduce the background stress your kidneys face every single day. They are not a replacement for medical care, but they are a foundation that makes everything else work better. Your kidneys are not filters sitting passively in your lower back. They are living systems that are responding to everything you eat, everything you drink, and everything you take. And after 50, they need your attention in ways they did not before. The difference between catching kidney damage early and discovering it too late is almost always awareness. And you now have that awareness? Do not let this moment pass without acting on it. Talk to your doctor. Get your numbers checked. Ask the questions. Because what you understand about your body is what protects it. And your kidneys have been protecting you your entire life. It is time to return the favor.